Hi again, everyone. Fourth video now. Okay, so had my surgery yesterday, as we know. Was in a decent amount of pain, but was okay because the drugs they give you there are fabulous drugs, fabulous. I am currently taking, I believe I said this in the last video, but they're T3s minus the caffeine, which is good. So you don't get, oh, stretching hurts. Don't stretch after getting implants. FYI, if you can avoid any kind of anything doing with your arms, they'll tell you, but it just kills. Chest is okay. I've been icing my chest. A couple things that are important I'm going to include in this video that I think that people should be aware of. Can particularly happen to you that's not necessarily good. And I'm going to unclasp my bra a little bit. Try not to be too revealing or crude. Just want to show you where I'm sitting with my implants as of today. So I've been out of surgery now for over 24 hours, and the upper part of my chest is very, very tight. The part that hurts the most are the sides, right under the armpit. That is definitely like right here and right along here. Just super, super painful. And that was painful showing you on my left side where that hurt. This is what I'm taking for a prescription right now. I got 50 tablets of, like I said, the T3s, but minus the caffeine. So it's acetaminophen and codeine. So basically when I left, I had iodine all over my jawline, all down my neck, all over my chest, stomach, a little bit down my back. And when I did take off the iodine with baby wipes, I noticed that I had a rash, which I did mention in my last video as well, and the rash has gotten worse, progressively worse. I took a Benadryl a few hours ago. It's turned even worse, more into hives. I've been in touch with my surgeon, and she said that she believes it is one of the antibiotics that was given to me prior to my actual surgery, and the name of it is called urticaria. I am allergic to penicillin. I don't know if they're affiliates. She believes that's what it is. I'm going to see her tomorrow morning, Sunday, and hopefully narrow things down and figure out what exactly it is that's causing this, because if Benadryl doesn't work, and Benadryl works on me for any kind of allergic reaction I've ever had, a little bit concerning. So what she has basically said is if I'm having trouble breathing, to go to the ER. Fingers crossed, because that's scary. I don't want to have trouble breathing. But right as of now, nothing except that the rash is all over my legs now. Not on my arms, so it's my face. Can't really see so much in this video, but my face is like really inflamed and red. I'm gonna kind of close up here. You can see my chest, just all here, and in my neck. And you can't really see because I have a really bright light on, but it is really, really welty and lumpy and so itchy. I just like want to scratch my skin off. It's so painful. So, yeah. Never had an allergic reaction to anything before except penicillin, so I think this is something like an affiliation of penicillin. What else can I say? One thing that I didn't do, in the information I read, I scanned it over, the information they give you after for aftercare. Get a stool softener. Sorry to be gross. See how I'm all puffy? My face is puffy. My fingers are puffy. I'm retaining so much water. Basically, the acetaminophen and the codeine will make you very, very constipated. And I'm talking super mega constipated. So I haven't had a poopsie in a while. So I just sent my boyfriend out to go get me some laxatives, which they recommend is you take a stool softener. So, yeah. So as you can see, my boobs are still sitting very, very high. I slept sitting up last night. Last night was the most pain I think I've ever had before. And I've had a C-section, and that doesn't compare to this pain for some weird reason. My breasts are sitting, you can see, really like almost awkwardly, like out of my armpit. And then when I take my bra off, you can, like, they're very torpedo shaped. And yeah, sorry, I'm itching. So gross. I'm so itchy. Everything's so itchy. And yeah, they're very torpedo shaped. They're not shaped properly at all. So I am super happy, and I can't stress enough that I invested this money in this quality garment. This is the surgeons of the place I went to. They always use this lady for the bras that she uses, because they just give the perfect support and are going to give me the exact shape. So still just waiting. Obviously it's only a day, but they said about 2 weeks this is going to drop and go into like a full nice round shape. Originally going to go with 533s cc's under muscle, then was going to go to 550, was too big for my chest. Ended up with 500s, which you can actually still see marked on me because I'm not allowed to bathe yet. See? 500. Yeah, it's kind of crappy to not be able to shower. I'm like a twice a day shower, so not having a shower sucks. After I see my surgeon in the morning, she's going to redo the dressings underneath my breasts, which I haven't had any issues with. No pain, nothing, no oozing, no bleeding. And after she does that, I'll be able to have a shower and stuff tomorrow. But I have really long hair, which you would have seen in my first video, and I can't do anything with it. I can't blow dry it because I can't lift my arms up. And yeah, staring at myself in this video right now sucks because I'm so puffy, but retaining water is not fun. First night's supposed to be the worst. And then from there, like, I'm already feeling better than I was last night. I was bawling my eyes out last night. Just the pain was overwhelming, even taking the pain medicine. And my body literally woke me up every 3 hours, 3 to 4 hours, like that, clockwork, because it was just like, okay, time for pain meds. You can see here my pillows are, I have a soft blanket but on it too, but my pillows are propped right up. So I was essentially sitting up, sleeping, which sucks when you don't have a big ass. I'm half Filipino, so we're just genetically flat-assed people. So I have no fat on my bum, so my butt hurts today. I was supposed to be walking around a lot today, but I just was not feeling up to it. So I'm going to go for a walk tomorrow, just around the neighborhood, maybe even the mall. I know you're not supposed to. Everyone that's watching this should know too, you do not want to get your heart rate up at all. You don't want to increase your heart rate at all. You've got to keep it down. You increase your heart rate, you dramatically heighten, you should say, your risk of blood clotting, which you don't want to do. So I want to show you kind of what's going on in here, but I'm going to try and show you being as conservative as possible, but I got a lot of boob going on, as you can see. So let's see here, like super high and just awkwardly shaped. But as the weeks pass and I progress with my videos, we'll see them gradually come down. After, I guess, a few weeks, I'm going to be able to put on more of a sports bra. From there, I'll be able to put on something with more of an underwire. But this is the bra that they recommend. I have my little instruction sheet here. All times for 12 weeks, so 3 months. I said 2 because of my size. Another thing, ladies, I'm sure you all know, I don't want to say anything that everyone's going to roll their eyes and say, of course you know, but the larger you go, more painful it's going to be. My surgery took 3 hours, typically an hour and a half to 2. I'm going to find out exactly why it took 3 hours, but my boyfriend was told that it took that long because they wanted to make sure everything was absolutely perfect. So that's a good thing for me to hear. I was happy to hear that. So hopefully this rash, and like I said, you really can't see it, but this is from an allergic reaction. Definitely bring this up when you talk to your, surgeon and say, there's a girl I heard about that developed a really, find out what your allergies are before you go in, because it's really uncomfortable. And hopefully they can give me something tomorrow, and hopefully my breathing is in no way affected tonight, in which case I will have to go to the ER. So 4th video, good luck to anyone who is, thinking of doing this, who is scheduled for the procedure. Although the pain is bad, I am thrilled. I'm super happy. This is the one thing that I've wanted that you can't get at the gym, right? Can't build boobies at the gym. I was originally 232 pounds. I lost over 100 pounds. Took a lot of hard work, but the only thing I couldn't change was my chest. So I got little pecs, but I couldn't get boobs. And these I'm very happy with already. But yeah, just be clean, take care of yourself, wash around, don't get your bra wet, keep it on like they say at all times. Don't shower, just listen to all the advice they give you. You don't want to increase your chances of infection by any means. So once again, this is what the boobage is looking like 1 day after surgery. So very swollen, but you can already see you've got some, as I'm hitting my boobs, got some decent shape going on, and it's gonna be a nice size. Any questions, please throw them at me. Open book, as I said in my last video, and I'm happy to help with any and all questions. Hopefully next time you see me I won't be so puffy and scary looking, but yeah, okay, take care. Bye.